like to call upon our next speaker, Dr. Neetu Vanapalli from India. Dr. Neetu, please take the stage. Thank you.
Yes, good afternoon, everybody. I'm here to present a topic on spleen, and let me share my presentation in the meanwhile. Yes. Can you people see my presentation?
Yes, it's visible.
It's
I think
visible. Okay.
now we can just
Yes.
see the screen. Yes, it's visible
Yes.
now.
Can
Please
Yes, we can
it's
see
visible? Okay. Okay. So let me give a quick briefing on the topic that I'm going to be presenting. Splenectomy specimens are taken into our study for this research work that we are going to present. And the splenectomies are done in all the whatever cases that are leading due to portal hypertension at Apollo Institute of Medical Sciences in southern India. So the contents, let me go through the quick contents. That is introduction, aims and objectives, materials and methods, results and conclusion. So that being said, let me start off with the introduction. Spleen being considered as an organ of mystery by Galen is as true as gospel. So because spleen is an organ of mystery and it holds many clues to whatever is going on systematically in the body, and indications for therapeutic splenectomy are hematological and cystic conditions, abscesses, infiltrative diseases, splenic rupture, and neoplasm. So the first ever splenectomy, let me give a quick glimpse on the history aspects of the splenectomy. The first ever splenectomy specimen was performed in Italy way back in 1549 by Zaccarello, which was later followed by Quittenbaum, who did elective splenectomy for portal hypertension in 1826. There were various studies and research papers published so far which have emphasized on diagnostic splenectomies and their diagnostic abilities. However, splenectomy may be a helpful tool in therapeutic indications as well. So my study mainly emphasizes on the indications of therapeutic splenectomy and its uses in today's day. So moving on to the next slide, the normal weight of spleen. So let's just give a quick brushing through what is the normal in spleen. The weight of spleen normally is considered as 70 to 200 grams, plus or minus 100 grams. Splenomegaly, what is it? It is the weight of spleen when it is beyond 400 grams, usually. So, but in our institute, we have considered it as anything beyond the normal weight. Splenomegaly, based on the weight, is again classified into mild, moderate, and massive splenomegaly. Massive splenomegaly is hardly seen in most of the institutes, and massive splenomegaly is prominent in those countries where there is Kala Azar. So mild splenomegaly and moderate splenomegaly is what we have also included in our study for today. Splenomegaly is based on the pathophysiological mechanism, which is again classified into 4 types according to the literature existing. That is, starts with congestive splenomegaly, infiltrative splenomegaly, immune splenomegaly, and neoplastic splenomegaly. So we have 4 variants of splenomegaly based on the pathophysiological mechanisms. In the existing literature, the splenic pathology was assessed based on examination of red pulp and white pulp. Cystic lesions for diagnosis in spleen can be another daunting task on imaging, as the nature of splenic cysts is not known till the histological diagnosis is made. So, I have done some research to find out how much of diagnostic splenectomies is useful for the clinicians and for the patient point of view. The diagnostic ability of the splenectomy was 46% in a study conducted by Patrick et al. They also emphasized that splenectomy may be a useful diagnostic and therapeutic tool in select unknown diagnosis and hematological malignancies like chronic myeloid leukemias. So as we should know, the location of the spleen in the abdomen, it is not protected by the bony cage, which makes it more prone to traumas and traumatic injuries. So the materials and methods that we have used for this study, it is a retrospective analysis of the splenectomies received by Department of Pathology, Apollo Institute of Medical Sciences and Research at Hyderabad in India. It is a 2-year study period conducted from October 2018 to October 2020, which includes most of the corona time, pandemic time. The tissue specimens were subjected to standard macroscopic and histologic examinations. 12 splenectomies were examined microscopically after detailed grossing, followed by processing and routine hematoxylin and eosin staining. The data regarding age, gender, and clinical details were collected. Results: the most common splenectomy had shown that the most common splenic lesion was indicated for congestive splenomegaly, that is 25% in most of the cases, followed by splenic rupture that due to trauma, that is 25% again, and epithelial cyst, which is 16%. I have given the major components only. You can later check on the pie chart where the minor components are also comprising. The ages of the patient ranged from the age of 24 till 52 years for the splenectomies, and there was a female preponderance that is 2 times higher than the males. Histopathological spectrum distribution, as you can see in this pie chart, there is the maximum component, which is congestive splenomegaly, is a main indication for the splenectomies conducted, followed by splenic rupture, which is 25% again. And then we have the epithelial cyst, which is primary or true epithelial cyst, that is making it 17%. And then followed by keratinous cyst, epidermal type, 8%, reactive follicular hyperplasia, 8% again, and extramedullary hematopoiesis, which is 8%. Also, not to forget the abscess component, which is making it of 9%. So also, if we look at the cystic lesions of the spleen, the cystic lesions of spleen is again divided into 2 components. That is the primary epithelial cyst, which is 17%, which is, it is more common than the keratinous cyst of epidermal type in our study. According to the study conducted by Sarangatham et al., highest cases belong to the non-neoplastic group, which comprised of 90% of their cases. And the neoplastic group was 11% only in their study. The age group that most of the patients belonged in their study were in the range of 21 to 30 years in their study. Yes. So quickly moving on to the next slide. It was observed that portal hypertension was a major contribution of splenomegaly in the clinical diagnosis. The majority of splenomegaly belong to the moderate splenomegaly category, followed by mild splenomegaly and normal spleen weight, that is only in 2 cases. So which says that we did not have any case of massive splenomegaly in our study of 12 cases. So this is a distribution pattern of the splenic weight in the across the 12 cases. You can see that the maximum weight of the spleen was taken by the case number 6, which had almost reached till 1,000 grams, but not crossed it. So it falls in the moderate splenomegaly category. And now, looking at the photomicrographs of the histopathology pictures of the red and white pulp. As we look into the first photograph, here I had captured a Gamma Gandhi body, which is a rust colored foci that you can see. It is made up of the fibrous tissue, hemosiderin, and calcium. This is stained by hematoxylin and eosin. It is seen on the low part. In the next figure, you can see the white pulp photograph where the lymphoid follicles are seen of various sizes with germinal centers, which means these are all reactive. It is captured, this photograph was captured on a scanner view by hematoxylin eosin staining done. The following figure shows a epithelial line cyst, which is lined by the flattened to cuboidal epithelium on medium magnification. Again, 10 power view this is. So we can see the lining cyst here, the flattened lining cyst of the splenic tissue. In the next figure, we can see that there is an abscess of the spleen indicating extensive areas of hemorrhage with neutrophil exudate along with lymphoplasmocytic infiltrates on scanner view. Yes, the next figure shows a congestive red pulp, which are comprised of dilated sinusoids and the thick-walled sinusoidal nature that is seen in this photograph. And there is also a lot of inflammatory cell component surrounding the sinusoidal tissue. This photograph is taken on a scanner view. The following figure shows the gross photo of the cystic lesion of the spleen. The solid content of the spleen is replaced with the cystic lesion, uniloculated, inner surface being smooth. So this is a table showing the recordings of the dimensions of the splenectomies received. And the maximum dimension is taken by case number 6, that is 19.5 by 15.5 into 5.5 centimeter, the maximum dimension. So the largest spleen that is. And the next figure, figure 8, showing us the distribution of splenomegaly in splenectomies, which showed that moderate splenomegaly comprised of 50% of our cases, followed by mild splenomegaly of 33% and normal being 17%. Massive splenomegaly had comprised only 0%. We did not have any cases in this category. Moving on to the conclusion part. So through this study, the histomorphologic evaluation based on the grossing and microscopic parameters have been recorded, and also found that the red and white pulp evaluation is pivotal in understanding the splenic pathology, just like in the existing literature. Elective splenectomy, when done timely, has influenced and improved the life course of the patients postoperatively, though splenectomies once done can increase the chances of infection in such patients by capsulated organisms, but even then the chances hold as good as patients getting suffered with traumas at home. So that is worth taking the risk, and performing an elective splenectomy will only relieve the patient from such symptoms, that is like pain, mild pain, dull aching pain in the quadrant. So these are my references, and I hope I have covered most of the topics related to the spleen entailed in the spleen chapter. And also a point to add on is the most common indications in the research when I have done, the most common indications for therapeutic splenectomy was portal hypertension along with splenomegaly, and abdominal discomfort was observed as a common physical symptom. And the majority of the pathophysiological mechanisms behind splenomegaly in the limited study, as ours, was congestive etiology. And so that being said, I would like to thank the organizers for giving me an opportunity to present our little limited study conducted at Apollo Institute of Medical Sciences, Hyderabad, India. Thank you.
Thank you, Dr. Neetu. It was a very well-researched study with an exhaustive array of the splenectomy specimens. I think for all of us, it is interesting to note that any splenectomy specimen